Thanks for joining Encephalitis411.org in its webinar series to celebrate and honor World Encephalitis Day. As you see, I'm wearing my red for recognition of the World Encephalitis Day, and we'll be doing a series of webinars. You probably have already seen one by now, to walk through all the different aspects of encephalitis. Today, we're going to focus on the caregiver role. I'm with Mary Karlovec, whose son had encephalitis 6 years ago, and Rick Station, whose wife had encephalitis almost 20 years ago. And by the way, if you haven't tuned in to our Facebook channel, please follow us at Encephalitis411. Before we start, I just want to kind of say that, in this series for caregivers, I'm going to have a very unique perspective that many of you will identify with. You'll likely pick up some new tips or new information to help you in your own role as a caregiver. And it's not an easy path, and it's certainly not one that we anticipated as a life-changing event. So to me, you are the heroes. The caregivers have been put into a situation that you were not probably trained for. You've likely learned enough about encephalitis to teach about it. And we honor you, the ones who figure out how to move life forward in the face of tremendous change and challenges. And we thank you for your sacrifices and unconditional love for those that you're caring for, and whatever that capacity might look like. Since my own diagnosis, I've had the pleasure of meeting hundreds of survivors and caregivers, each with so many unique stories. And it's just a heartfelt way of getting to know somebody. I've also met several hundred doctors that they hate the uncertainties of this illness. We know it's very frustrating. It's frustrating for them too when they can't figure out a diagnosis or the right treatment. So it's a very complex illness. That's why so many of us are bonded by this. But I've also witnessed some very remarkable improvement. A lot of people ask at the 2-year mark, are you not going to get better? And there couldn't be anything farther from the truth. Everybody's situation is very unique and different, but I've been especially moved by one caregiver and her sister, Carol, who I got to know probably 8 years ago at an eGlobal event down in Florida. And to me, it kind of underscores that role of the caregiver. Carol's sister's biggest advice when she found out we were doing this caregiver session is to listen and to understand your loved one. She treats her sister, who had very severe impact of encephalitis, like she should be. She's a person with deep emotions. She has the capacity to learn, and she deserves to be understood. And because of Carol's sister, she continues to improve. And it's in that spirit in which we're kind of sharing today. So the common denominator I find among the people impacted by encephalitis is that they're givers. They love to share knowledge. They like to share hope. We, of course, share some frustrations, but more than anything, we're there for each other. So thank you again to Mary and Rick today. Just real quickly, I'm going to talk about Encephalitis411.org. It's a very simple mission. We try to improve the quality of life for anyone impacted by encephalitis. And that's not just the survivors and caregivers, but it's the clinicians who want to do a better job, that want to think about it faster, as well as the general public, who often when you say encephalitis, you just get the deer in the headlight look, and they don't know what it is because they've never heard of it. I certainly never had. We have several initiatives. I won't go through all these, you can read, but we do want to improve the medical provider education here in the United States especially. And that starts with even the curriculum that's taught in medical schools. We've had one opportunity to do that so far, and we're looking at others. Just to make sure that the information that they're getting is the best and most quality, so that when they encounter somebody with encephalitis sometime in their career, they will have a better understanding of what it's like. And then just support each other, especially here in the United States. Insurance is probably a bad word, but we're trying to even connect with that community to try to improve the coverage that we get. Lastly, we've got several things planned for World Encephalitis Day. In addition to this webcast for caregivers, we have some for survivors themselves. What support services are available? That's with a therapist with Baylor Rehab. There's a lot of things that we typically don't hear about when we are diagnosed or we're thrown into this. And we want to make sure people not understand, and they may have to take it back to their doctor and say, hey, by the way, I would like to explore this type of treatment or therapy. And several others, as you see here. And then if you're in the Dallas or anywhere in the Texas area, Louisiana, Oklahoma, we welcome you to come in person on Saturday the 23rd for a free event. We have 3 people from Pate Rehab coming to talk about more in detail about rehab and treatment options, as well as a lady from the Center for Brain Health that will be talking about brain plasticity. So again, going back to that myth that 2 years is, you know, once you've got to that point, you're not getting better, is so false. And we really, you know, hope people will take advantage of some of the education to be able to understand what things that you might explore that you haven't yet. So today, this is really the real mission here, and I'm going to stop talking so you can hear from the real gurus. And so Rick and Mary, I'd like to turn it over to you. Maybe Rick, if you want to start and just kind of briefly introduce yourself and a bit of the story about you and the path with Wendy.
Sure. I am Rick Station. I am the husband of Wendy Station. She is the president of Encephalitis Global. She contacted Encephalitis back in 1999 in April. So it's been almost 20 years since the time she had contracted the disease. Giving you a sort of a brief synopsis of what happened. It's back then, from my recollection, obviously never hearing about the disease before, never knowing anything about it. It was really a eye-opening situation, not only for me, but for our family. At the time, having 3 teenage children, youngest being 12 years old and our oldest just moving into university, it had a very dramatic effect on the dynamics of our family, especially on our youngest daughter, seeing that their mother been inflicted with something that they couldn't relate to. It sort of devastated her and gave her a real I would probably say a harder growing up period to adjust to that new role where she couldn't lean on her mother as much. Going forward though, for Wendy and me, life has changed dramatically from pre-encephalitis to post. Wendy being more outgoing and full of life and more physically doing things like horseback riding and going for walks and stuff, to now more of a sedate type of a life role. Not to say that it is bad, but it has changed dramatically. And then I think we've embraced that kind of lifestyle quite well. It has impacted our kids and our friends, because we are not the same people. But what it's done is brought Wendy and I closer together, and also brought our kids closer together, because you have a new sense of vulnerability in your life that was never there. And as kids, everybody is invincible, and they don't realize, or never had that happen to them. So life as moving on has obviously had its ups and downs, and more downs earlier on in the encephalitis impact. But now as life moved on, you've adjusted, and you've made your life, or our life, a lot simpler, and we really come to embrace this life and enjoy what it has become.
Great, thanks for sharing, Rick. Yeah, I think not having had kids at my home at the time, it certainly didn't impact my son as much. But when I listened to your story about 3 teens that were at home and watching all that and seeing their own mom kind of struggle with things that she didn't struggle with before. That must have been very frightening for them. But I'm glad to hear it made y'all closer as a family. There's always that silver lining.
Yes, yeah, and yeah, you're right. It did change the roles of the family, and it actually in in a sort of a back-ass way made the kids elevate their life. They took more control in the family and became a lot more part of it, which was kind of neat in a way, and
Yeah.
it definitely helped me out. I would hate to think of how more it would have been if our kids were, let's say, in early adolescence or even young infants. That would
Mhm.
have had maybe a bigger impact on the way we address it as a family.
So they, in a sense, also became caregivers, it sounds like.
Yes, they did, and if it wasn't for them, they helped me through a huge part of it, just being there and taking up some of the slack, as I have been the chief not caregiver, but the financial person in the family. I still had a role to do for the family, and the kids stepped in and to a big extent. I was very appreciative of how they stepped up to the plate. It was very heartwarming.
Yeah, that's great. Well, Mary, I think your experience has been very different, right? Having a son that's gone through it. Would you mind sharing your story about how everything kind of unfolded for your family, especially for your son?
Our story is very different. Matt was 6 years ago last week, and he has just started his first year of teaching. He was teaching autistic kindergartners. We thought we had life by the tail, and he was looking forward to being able to move out. His girlfriend in Columbus, they were starting to talk down the road, and he came home with a headache that night that he said was the worst headache he had ever had. I was fortunate that 2 o'clock in the morning, I heard this noise. I didn't know what it was, and it was actually Matt seizuring and falling out of the bed. And not knowing what was going on, his fever was out of control, 106 degrees, and it just totally, as Rick has said, turned our life upside down. At the hospital, they said, oh, it's not meningitis. And I was like, oh, I knew what meningitis was, but they said it's encephalitis. And I thought, what is encephalitis? And then we were fortunate there was a doctor there who kind of knew what encephalitis was and was able to help make some quick decisions. But it was a very difficult beginning. And the last 6 years have gotten better. Matt has made a lot of progress, but there's still a lot of areas that he has, like he is now in a wheelchair because he has neuropathy in the right leg and in the left arm. It literally wiped out most of his brain. He does not read or write anymore. Totally changed our life. But like Rick said, you kind of learn to roll with the punches. You kind of learn how to make changes. The first couple of years for Matt, we didn't even know some of the things that were going on because he wasn't able to tell us. But you kind of learn as you go along and adapt, make changes, and hope that the changes that you're making are in his best interest and the best interest of everyone involved. Has no brothers or sisters. I had just turned in my retirement papers to retire after 36 years of teaching. My husband was almost retired at that point. And so it just totally changed our plans for what we were going to be doing also. Fortunately, Matt has a very wonderful now fiance. She has been here from the get-go, and without her support, I don't think Matt would be where he is today. So very different story, but in some ways a lot of similarities. those first couple years were rocky, but after we continued to make progress. And that is the one thing that I have to keep reminding myself over and over, that 2-year number is just a number. It is just a number, because I see him continuing to make changes every day.
That's great. But one thing you said, Mary, kind of strikes a chord with me when you said sometimes we don't know how to express what we're going through. I call it the I don't know what I don't know kind of philosophy. And I didn't know for years that especially horizontal stripes or blinds, if somebody's wearing like a very striped shirt, especially where it kind of gives enough of a visual stimuli to cause the vertigo. But I remember Matt and I talking about both the visual and auditory oversensory, and that we shared that in common. And I did take a tour of a rehab center, and they wanted me to write a story on them. And at the end they said, well, what'd you think? And I said, it's brilliant. I mean, you've thought everything through, from somebody that has, very low cognition and is just getting started to somebody that is ready to go back in the working world. But you have blinds in every room, and I was dizzy the entire time. And they said, well, no one's ever told us that. And I said, well, they probably don't know what's causing it, because it took me so many years. So I think that you don't know what you don't know is so true, and probably something that caregivers have to be aware of is, when somebody gets agitated, let's try to figure out, what's in the room that could possibly cause that. So yeah, that's kind of intriguing.
Like, we didn't know the sensitivity for Matt. This hearing was so sensitive that when they finally were able to do a hearing test on him, they said he has the hearing of a dog. And so no wonder all of that stimulation was just really overwhelming him. But everybody thought, oh, he's wearing headphones, so let's yell at him to make him know what we're saying. No, it's not that he can't hear. He can hear. So it's a real learning curve. It's been that for 6 years, and wow, I still have a lot to learn.
And I think that's the problem, or is the unknown, that you don't know what's coming up. And if you had, and maybe they haven't figured out encephalitis, because there doesn't seem to be a straight linear timeline on it, because there's different degrees of severity, if we talked about before, after 2 years type thing. But we find the ups and downs and valleys and of what is transpiring, where 1 month Wendy would be just almost right as rain, and she's on top of the world, and the next month depressions come in, and everything, like the light would bother her, or now she needs to sleep 12 hours a day. It was like a Jekyll and Hyde scenario, and that really affected me more, because I couldn't, as a caregiver or a husband of your spouse, you want to protect them and do what you can to help them, and there's nothing tangible about it. You don't know where it's going to end or land, and you're basically shooting blind a lot of the times, and all you can do is sometimes, it seemed for us, is especially in the early times, is just to hold them and just be there, so they knew at least they had physical support.
And then when you were asking, like, you would expect doctors to have the answers that you need, and to understand what encephalitis is, and when they can't answer your questions early on, and you're like feeling you're walking kind of over a minefield, what's going to happen next, and how do I deal with that, and how do I explain this to people, and it's really difficult when at the very beginning they told us, find a good place for a good nursing facility, because he probably will not get better. And my brother was standing there at the time when they said it to me, and he said, "Oh, you do not know my sister." But because, most people looking at Matt those first few weeks would have said, yep, he's not going to get any better. So, but you just have to keep asking questions. And, like you said, Rick, those, peaks and valleys, you've got to embrace the good and roll with the bad.
Absolutely, absolutely. Same thing with when Wendy finally came out of the hospital and stuff. I went to our family doctor, and obviously she was familiar with the case. And I came into her office, and she sat me down, and she admitted to me. She says, "I have never experienced a case of encephalitis before." So she opened up her computer, and we sat there for an hour, her and I, in her office, going through what we could find, and we learned about it together. And then she made a vow to me that she would find out more, and she went and talked to other people, and she was amazing. But I think the fact that she, which kind of brought it down to my level, is that she had never had it before. It wasn't her standing up there saying, well, encephalitis is this, and the clinical ideas of it. She had some empathy for me, and what I was going through, and she wanted to make sure that I was okay and that we both could find out what we needed to know. And that really helped me, especially in the earlier years of this. So I had someone who would help me together. I wasn't just sitting there on an island by myself trying to figure out which is up.
Well, it's always encouraging to me when a doctor's willing to say they don't know. I'd rather them say that than try to play like they know. Or
Absolutely, yeah.
Right. So hats off to that doctor, especially for going through the journey with you. It's there's a great book by Dr. Jerome Grootman called How Doctors Think, and he kind of has chronicles several different complex cases. Varying, is not encephalitis related necessarily, but very complex things that took years and years. Some people, 15 years to figure out, because every doctor kind of dismissed them and said, it's stress, right? Right. And stress causes a whole multitude of things, right?
Of everything,
Yeah. It can't explain encephalitis, unfortunately, but anyway, but in his book, he talks about, doctors need to be willing to say, I don't know, and they'll learn it with you. And so I love that.
And that's so true, because Matt, once he was able to start advocating for himself somewhat, he would say to a new doctor, what do you know about encephalitis? And if they said, I don't know anything, he would say, are you willing to learn? And kind of kept him off guard. And there were a couple of doctors that said, I really don't know anything about it. And we kind of passed them right by. But he asks now, what do you know about encephalitis?
Good.
Excellent.
Well, I'm going to move on. We've covered a little bit of this, but I'm sure there's some things that we haven't talked about yet. But maybe each of you can talk about, what were your biggest surprises, kind of the fears, the unknowns, the needs for resources. I mean, talk about having doctors who hadn't seen it before, but were willing to learn. That's good. What were the first few months like for you?
For us, we went directly from the hospital to an inpatient neurological rehab center at one of our local hospitals, and spent 7, almost 8 weeks there. And that's where I still started to get the idea of, well, we are up against a big wall here. The nurses were wonderful, but they admitted, we work with stroke patients. We work with patients. We've never worked with someone with encephalitis before. So I really feel that they tried really hard, but they couldn't answer all of my questions. From there, we went to another rehab facility, which, hindsight being 2020, was not a good place for Matt, because it was a nursing home facility, and he was a young person there among all these older people, and they were treating him and doing therapies and things with him that were not really appropriate for someone who has a neurological. There were, again, used to working with patients who have strokes and broken bones and things like that. So it was really difficult, and we had to part ways eventually. But for the first, this happened in February. It wasn't until August that he came home. He came home, and he came home with a wheelchair and a walker, and a house that is not handicapped accessible. So it caused for some real changes. But it really changed his life. He did not speak a lot at first. It was really difficult, and friends really found it hard to come and see him and be there, because this was not the Matt that they knew. And it was just, for me, it was heartbreaking. It was emotional. It caused a lot of anger. I was angry sometimes, and that kind of spurred me on to even do more. So that first year was a real tough one for us.
Yeah, I concur on a lot of stuff you said there, Mary. When Wendy came out of the hospital, she was in for a month, and then she went to like a same idea as a stroke facility that we would go visit 3 or 4 times a week, and that was more to bring her back physically. She had a bit of paralysis on her left side, so that was bringing that back, but also recognition of things, and to learn, where she'd see a spoon, she would call it a potato type thing. Mm-hmm. And they worked with her quite a bit. And then from that, and she was doing that for about 3 months. And then from that, she was visiting a psychiatrist and a social worker. And that really helped out, because I think what we found from that, it gave her, especially with the social worker, the woman was amazing. It gave her some self-worth. She had, she was feeling really low and obviously not understanding what was happening to her at all. And just having a person besides me to talk to made a huge impact on her, that she could sit there for an hour or two and cry and get her emotions out. On another thing that you said there, Mary, that we really noticed is that some of our closest friends, after Wendy had encephalitis, it was something that they were not familiar with, and it sort of was like a cancer. And those friends had sort of stepped away from our lives. It was sad, but unfortunately, that's how they tended to deal with it. Where we had other friends and family members that stood up, stepped up to the plate and were more than helpful, and it not only supported Wendy but supported the rest of my family, which was incredible. But it's amazing the difference that who you would have thought would have been or one of our closest friends have now we don't see anymore, and that's just the way it is. I'm not mad at them. They just can't face the whole idea of they did see Wendy probably at one of her worst stages, and they refuse to be part of it anymore.
And that's very true, because a lot of comments that were being is, well, he still looks like Matt. Well, yeah, he does look like Matt, but there's a lot there that has changed. And it was really difficult for friends to see him wearing sunglasses all the time and headphones and, sitting in a wheelchair. And they wanted to talk to him about how the olden days were. And long-term memory was there, but short-term, so he couldn't even tell you what he had for breakfast that morning. So, that just really made it very difficult for both family and friends. And you're right, Rick, that, some friends have been there from the get-go and will always be there, and others, it's just a real difficult thing for them to deal with. And so it's the best way is to move away. And
then move on from that, because it's not helping the situation.
Exactly. exactly. The other thing that for us was, as encephalitis unfolded, is my husband and I had always worked. We grew up with the work ethic of you know, worked, you dealt with things, you paid for things yourself. And when all of a sudden there wasn't any insurance for Matt, and we had to look at things like Medicaid and, you know, looking at other resources for Matt, it was like, where do you go? How do you do this? And so not only were we dealing with Matt in all of his medical issues, we were dealing with, in the United States, the whole medical aspect from the insurance issue. And, you know, he no longer had any money coming in, and you know, he had student loans and bills that had to be paid, and who was going to pay them and how was it going to be done. And so it was that part also for us that was a real struggle, especially the first couple of years, because you didn't know who to go to. And when you talk about encephalitis, I remember the first time when the Medicare office, the lady looked at me and said, well, what exactly is that? And I tried explaining it to her, and she goes, oh, it's like a stroke, right? He'll get better. And, you know, it just is like, oh, you get tired of saying, this is what it is, this is what's happened, because we really don't know a lot about it. It's kind of that mystery disease that's out there.
Largely true.
From where we were, Wendy contacted it, and I think she was 44 at the time. And, you know, kids were growing up, and, you know, we were looking more into, you know, our next phase of life, you know, to, you know, do lots of traveling and doing this and that. And obviously that has changed quite a bit because of that. But also it changed our whole idea of life, as I guess the fact that you never think of yourself as vulnerable. And as a person, you never want to show, and I think that's a North American thing, any vulnerability to anyone. You want to be a strong person and stuff. And to open up and show your vulnerability was tough, was very tough on Wendy and on our family when we had to go through this. And now we've changed our whole life because of that. We live a more simple life, you know, we're obviously less stress and stuff. But, you know, I retired early because I wanted to spend more time enjoying life instead of being in the rat race. And that was a conscious decision that both Wendy and I made, that, you know, we want to enjoy the good years that we still have left, because we don't know what's going to happen again, or if it's going to happen again. It's not a conclusion that anyone's aware of.
And for us, it was just the opposite. I had to go back to work full time out of retirement, just so that we could make sure that Matt had all the things that he needed in order to be able to have therapy, have the right equipment that he needed, have the tutor support, all of those things that are not paid for under his Medicaid. And so we knew in order for that to happen, you know, we had to kind of revamp and think about, okay, how can we make this work? Which meant me going back to work. Dad then became the caregiver at home.
So I'm familiar with both your stories enough to know that Matt's cause of encephalitis was unknown. Wendy's was known. So it'd be interesting, I think, for a lot of folks, especially from the caregiver side. There's a lot of frustration when somebody doesn't know. And if you look at the pie of known causes of encephalitis, it's actually less than 50%. Right. And that's combining everything between mosquito-borne, herpes simplex encephalitis, autoimmune disorders. If I didn't say it already, the mosquito and tick-borne. I mean, there's a lot of different causes of it, and very rarely rabies, because you don't hear about many rabies cases. But there's actually a young girl that got that and was the only survivor to date that anybody knows about in the whole world that got encephalitis from rabies and actually lived to talk about it. A lot of people spend a lot of time and frustration over not knowing versus knowing. But I'd be interested from your different perspectives. Did it make a difference? I guess, Rick, you know, did it make a difference that y'all did know, or does it really change anything? And I guess for Mary, you know, does that keep you up at night, not knowing, the cause and what, the exposure might have been.
Yeah, from my perspective, knowing that Wendy had herpes simplex encephalitis, it was good to put a label on it, not just encephalitis.
Yeah.
I mean, maybe that could be just me, or having something I can hang my hat on, and they can say how it was contracted from her. So in that respect, yes, I was very happy, because I hate unknown things. That would drive me up the wall. So in that respect, that's good. But it's still the same encephalitis, going forward from that, of all the symptoms and what people have to go through.
Yeah.
I agree. When they first said it was unspecified viral encephalitis, I said, what does that mean? And they kind of gave me a brief story. We know that Matt had a really bad case of the flu prior to this getting encephalitis. So it could have been something from that. One doctor felt that maybe there was a really very small hairline opening into his brain, and the virus went up instead of going out of his body. But at that point, our whole concern was, okay, where are we at? What do we need to do? And how are we moving forward?
Yes.
So no, I don't think it's ever really bothered us that we don't have a title for what kind he has. But it's what can we do now and how do we make it better? And I think that's where we kind of focused, as opposed to what does it look like and what should it be? I mean, sometimes Matt will ask, what do you think it is, Mom? And I'll say, I don't really know, Matt. But you're here, and that's all we need to concentrate on.
Right. Yeah, and often the cause, even if they did know it, there's really not much to do other than treat.
No.
Because like Rick said, I mean, encephalitis is encephalitis. And, you've got to move forward and figure out, what do I need to do to make the situation work?
Yeah. I think for autoimmune, they're coming up with more and more research in the last 10 years. And I think that, that specific cause, if they know that that's the cause, has some new treatments that are becoming available over time. But I think for most of them, and like in herpes simplex, I mean, if you give a cyclovir, which is critical in those first 24 to 48 hours, then that can really make a huge difference. But for all the others, it's kind of, if you don't know what caused it, how do you treat it? And so that's the frustrating part, especially for doctors. There are some very good ones out there. I know a lot of people have run across some bad ones, but they get so frustrated. They are scientists by nature, especially the infectious disease guys. And they're usually the first on the scene, in addition to the neurologists. And I've heard them be even more frustrated than the survivor and caregiver community that they don't know.
Right.
We're hoping to do a lot more research in that area, and hopefully there's more causes that we can find along the way.
But if you look at the Inspire website, a lot of people are asking, how do I know what kind it was? How do I find this out? What kind of tests can be taken? And I think we maybe sometimes focus a little bit too much on what kind it is and what do we need to do about it.
To go forward, exactly.
Yeah.
You're right, Mary.
So advice to other caregivers. I mean, you've both been in a unique role to have given care to your loved ones in different capacities. You talked about, either retire early so you could spend quality time together, but that's, of course, over some time. You talked about going back to work because of the necessities for all the things that insurance and our beautiful healthcare system do not cover, especially in the U.S.
Move to Canada. I think that'd be better. That's an advice.
Interesting to hear kind of over time. And Rick, this might be more pointed to you at first because it's been farther along, but what was it like in those first moments to kind of, let go, if you will, to know that, your loved one is improving, maybe she's ready to drive again, maybe she's ready to go on a trip by herself again. What was the experience for you in those different milestones? And then Mary, I'll come back to you and kind of a similar question.
Becky?
I can hear you, but your camera's still. I think there might be a little gap. We'll pause for a minute. We'll come back to you. Rick.
If I
Oh, okay. I
Oh,
think
there he is. Oh, he's
there
back.
you are. Okay. I'm not sure if you heard the question or not. Do I need to repeat it?
Yeah, I think you need to. Sorry, Becky, I lost the connection there just for a second.
No
Sorry.
problem. No problem. I was thinking that from your perspective, since more years have passed,
Yes.
that there's probably been a lot of milestones, and some where you might have been a little trepidatious, I guess, about letting Wendy go on her first trip away without you or without assistance, or maybe her first drive, you know, whatever those milestones might have been. But what has it been like for you, and what advice do you give to caregivers when you know, quote, are letting go and let her fly her wings?
Yeah, that's a good question, and you really, it's a real fine line, because obviously you need to, in our situation, you want to give them as much confidence that you think they deserve, so they can go out and so they feel like they're a whole person and can contribute in society and life as a normal person. But as a caregiver, you want to hold them tight and keep them close, because you don't want anything bad to happen to them. So you really kind of play a real fine line, tight rope type of situation, and it really you really have to. I'm trying to think of a right way of saying it. It was really tough to let Wendy, you know, when she wanted to get back to driving again and stuff, and I did feel confident that she could, but then I'm as a husband and a loved one, I was really concerned for her safety and stuff. But eventually, yes, I did make sure that, and I tried to make all precautions that I could to make sure that, you know, everything would go 100%. And I did try to support her in everything she wanted to do, because that's what we're here for.
Mm-hmm. Yeah, that it is. I can't imagine the balance between letting go and saying, all right, you're going to make these steps because you have improved, and going, oh, you know, I need to protect. But I don't know, Mary, do you feel kind of a similar sense?
Yeah. I think for me, one of the hardest things has been the letting go, because the protective mom comes into play. And just one example, the first time Matt and Kathleen, his fiance, went to Columbus overnight by themselves without us in tow, I was a nervous wreck, thinking, oh my gosh, what's going to happen? You know, is he going to be okay? And, you know, does she need my help? And it was like, you know, I had to start letting go and letting those things happen. And it's still really hard to do, because you want to protect them, but you also then do want them to become more independent. And it's just, that has been for me the hardest thing to do, is that letting go and being able to say, you know, I've got to trust Kathleen and I've got to trust Matt, because they're the ones down the road that are going to be dealing with this for the rest of their lives. So I think it's, you know, those baby steps of letting go and moving forward, and kind of making some plans as to, okay, what are we going to do next, and what is that going to look like, so that it's not scary for me and it's not scary for them.
But I think as a caregiver, you'll always worry, and you know, that's just human nature on our part, that, you know, regardless of what we give them or not give them, or how much we let go, will always affect us. I find that even me, if I want to go away for a night or two with my friends, or do something, I really can still consider it. You know, should I do this? Should I not do it? I know she's going to be fine, but I'm still worried. I think that's just the way you are. I'm happy I'm that way, because I think that's the way you should be.
And I think from that, advice then becomes also okay, you're spending 24/7 with your person who's had encephalitis, and I have forgotten about me and how to deal with all of the things I need to deal with. Like for Christmas, Matt asked, Mom, please make sure you get a physical. That's all I want for Christmas, because it was like I was always putting it on hold to take Matt to doctor's appointments or therapies or things like that. And so it's not only, you know, baby steps with your family member who's had encephalitis, but also baby steps for yourself to make sure you take care of yourself too.
Yes. Yes.
We're going to cover that in just a second. Before we leave this slide, I have one other question. And this is probably one of the more common questions that we get either from our hotline or emails or text messages that we get. And it's usually the people in the first year. And they're saying, you know, in some ways, the illness is invisible, you know, and one day their loved one seems great. And then the next day they're sleeping that, you know, 12 to 15 hours. And then the next day they might be all right. And then 3 days later, you know, there's another backslide where, you know, they're ready to kind of give up, or, you know, they get very emotional. What advice do you have for caregivers, especially in that first year where there's a lot of uncertainty, and in some ways, you know, we've all met tons of people right by now that are survivors. And a lot of them, myself included, you know, most people would say, well, you know, can't see anything wrong with her, but they don't see the list of medications that I take to be, right, quote, normal. Y'all are probably going, well, she's really not normal. But anyway, but, you know, there's a lot of things that are invisible. And I think for those caregivers, it's especially hard because they can't see what the person is going through. So any advice just in year one in general, as well as for the times where it's not really evident to you what your loved one's going through?
The advice is, yeah, it is an invisible disease. Quick note here, Wendy and I do some mentorship over at our local University of British Columbia, for all the medical students. And we go in there, and we've done this for the last couple of years, where we go in and we're mentors on fourth year medical students, and they all range from doctors to nurses to physiotherapists to even pharmacists. And we sit there, and there's four or five different medical students to Wendy and I. And the first question we ask them, we sit down there, and they say, you know, we introduce ourselves, and we say, which one of us has encephalitis? Or who can you recognize? And I would say half of the time they pick me. So it's, you know, because, you know, as you said, you know, they talk well, or Wendy seems to talk well, very rational, very smart, you know, but she does have her downsides. And then over the course of the year, this will come out as we work with these students, and then they can see, you know, the more of the day-to-day stuff. The initial you know, hi, how are you stuff is pretty normal for anyone. It's once they, you know, you've put into different roles or different situations where they can see how things will affect them a bit more. And that's, I think it's a neat an analogy when they look at this and they can see, well, these two people look normal. Why are they mentoring us? And why is one of them have something that we don't even see? It's unrecognizable. It's very invisible. And we love doing that with them. And as I said, at least 50% of them get it wrong, because they just see, you know, two people sitting there. They don't feel what, you know, what's really transpires.
Yeah, that's a good point. My entire family says I gave it to them. So they're all, I have a short-term memory issue. They blame me. But Mary, I mean, on contrast, I mean, you've talked about Matt's wheelchair and his the headphones that he uses to help with the auditory. So his is, quote, visible, but probably still not understandable. So I don't know if you want to respond to that, or kind of that first year advice for caregivers.
One of the things the social worker, when Matt was in the first rehab facility that he was in, is the social worker said to me, journal, write down your questions. No question's a stupid question. Make sure you write them down. Ask the nurses, did you see this? Did you notice this? What can I do to help with this? Because Matt didn't speak almost the first, I would say, 3 months. He used sign language, which he knew from teaching his autistic students. And so they had, you know, the sign alphabet and simple words plastered all over his room so that we, anybody who came in and he was trying to communicate with them, you know. And so if I wasn't there, I would say, you know, when I come in, I want to know, you know, what transpired today, what therapies did he get? And if you didn't ask the questions, you didn't get the answers. So, and that's something I really think a lot of caregivers, you know, they're so overwhelmed, but they've got to stay on top of it. They've got to ask the questions and make sure that they get answers that they're satisfied with, not just, well, I don't know, you know, kinds of things. And for us, that was that first experience in that rehab facility when Matt finally did come home was the reason we went back to their outpatient rehab facility for all of his therapies from that point on, because they gave us the time of day. They explained things as best they could. And if they didn't have the answers, they, like Rick said earlier, they, you know, let's see if we can find it. Let's see if we can find an answer. Because we didn't know at the beginning that Matt's hearing was so acute that it was bothering him. We didn't know vision was an issue because he couldn't tell us. I mean, we didn't know he has no peripheral vision because he wasn't able to say, hey, I'm supposed to be able to see out the sides, right? And I'm not, kinds of things. So you just have to constantly be observant and aware of everything that's going on and make some changes. And some doctors even said to us, you know, I really don't think he has encephalitis because he doesn't look like he has encephalitis. What does encephalitis look like? I mean,
exactly.
I mean, go to an encephalitis conference. There's no two people there that, and I think that'd be a neat thing for Wendy to do at a conference. For new people, who's the people with encephalitis and who's the people who are, you know, the caregivers, and see if people can pick them out, because you can't.
You can't. That's right. You look around the room at a conference there, and you'd be hard pressed to pick them out. Mm-hmm. Absolutely.
So would be my advice to them.
Okay.
Intelligent.
So that's great. And kind of moving on to what we were just kind of on the surface of a second ago. You know, taking care of yourself, it sounds like, okay, yeah, I need to take care of myself. Sounds like something, you know, somebody could say, and it sounds easy, but oh my gosh, when you have so many responsibilities, and you know, especially when you're trying to be observant and try to take in, okay, what other limitations or symptoms should I be paying attention to? It can be very demanding. So what advice do you have for other caregivers? I'm sure you probably learned the hard way, right? Because you don't do a training before a life event like this, and that you have that guidebook and you know what the heck to do, right? So what do you wish you'd done different in some ways, and where did you learn along the way that helped you take care of yourself and give yourself a break while caring?
Yeah, that's another good question. What you do, I think the first thing is when this happens to a loved one of yours, you dive into it so deeply it doesn't matter. I mean, that's the way it is, and you are there for them 24/7, you know, 150%. That's what you do, and it's not until down the road, you know, 2, 3, 4 months, a year, that you can come up for air and then see, okay, now we're at a place where, yes, I can take some time for myself. That seemed to be what it was for me. You know, I just delved right into what needed to be done. If I had to stay up half the night or whatever Wendy required, I was there for her. I just did it. But it comes to a point, and I felt it in me, that where if I didn't step away from it, I would be an adverse on my health. And luckily, you know, in our situation, the kids were old enough that they could step in a bit so Dad could have a break. I did go back to work, but I was working, it started off part-time and then I went back into full-time. But even then, that wasn't a break because it was still something we had to do for the family. I do recommend you need to have a break, and you need to have confidence in some other family members or close friends to help step up and give you that thing. Me, it was more of a physical thing. I needed to get out and just get rid of some of my stress that was building up inside me, because you are on 24/7. You're looking for this, or all your senses are at 150% all the time, and you can't live that way all the time. You need to take a break.
Yeah, good advice, Rick. Thanks.
My family's listening in, so I'm one of those. Don't do as I do as I say.
Yeah.
Because that is probably the thing that I am the worst at, is because Rick's right. It's, you're on 24/7, you're giving 150%. I still haven't learned my boundaries yet as to when I need to say, I need your help, and when I can say, well, if you'd like to help, and get away from, no, I can do this. Don't worry, I got this covered, kind of thing. Because that for me is the most difficult thing still, is I just, being that, I don't know if it has to do with Matt having been an only child or what, but I have a really hard time letting go. And I think I'm just starting to learn that I've got to have those breaks. I've got to say, could you do this for me? But again, it also goes back to Kathleen's smiling over in the corner. She's just smiling. Because I have a really hard time with this. And I think part of it is you think, okay, well, how am I going to make this better? Some of it, I don't know, maybe it's guilt, some of it, I don't really know. Or frustration. I just know that sometimes it does get to you. So I think I'm starting to learn how to let go and to rely on other people. But it is definitely something caregivers have got to make sure they're taking care of themselves, because if you're not taking care of yourself, you can't.
Then you're almost a liability to the patient.
Exactly. So do as I say, not as I do.
That's pretty normal to me.
Yeah.
So we've covered a lot of territory, and some that we hadn't really planned yet. But are there anything? There were a few questions that people submitted. So before we move to that, I was just going to ask, what have we not talked about that you feel like is important for caregivers in particular to think about on their journey?
I think for me, having found Encephalitis Global and Inspire, which came about as a result of one of the sessions in Encephalitis Global a couple years ago, is you've got to have resources. You've got to have people you can just talk to. You've got to have people that you can say, oh, wow, they're in the same position. They understand. And I think the biggest thing I've learned about encephalitis is there are so many people who don't understand it. And as a caregiver, it's our job to get the word out. And actually, this is one of Matt's biggest goals, is he wants people to know. That's why last year he did a whole weekend with his fraternity at Heidelberg University on what is encephalitis. Wendy did a Skype with them, a Q&A one for part of one of the sessions, just about the more information you have, the better you're going to be as a caregiver and making good decisions for your family member. That's my take.
Awesome.
That's excellent. And for me, I think and for Wendy's perspective is encouraging her and being her raw person.
Mm-hmm.
And for, like, as you said, for her, she's made it her life purpose to help others with encephalitis, and she's constantly on the phone with people whose other spouses have contracted encephalitis, or they had it and they are lost, and trying to put them into helping them and giving them the right resources to where they can look and help out. And that's her life goal, and that's given her purpose. And I think that makes me happy that she's found something new that's kind of revived her life, because the first couple of years was very devastating, and now it's given her a new purpose, and it's given both of us a new purpose. And I'm her number one fan.
Well, and y'all should be proud, because otherwise none of us would know each other, right?
That's right, Becky. You're right.
So thanks for all those comments. We have just a few questions that came in, and let me kind of look at those real quick. One of them is, how do you keep yourself motivated when you're feeling overwhelmed? I know you talked a little bit about that in the how you take care of yourself, but this one is probably a little bit more direct of, it is overwhelming. And so, what's your go-to? Is it, taking a time out? Is it getting a massage? Is it reading a book? Is it going for a walk? Is it prayer? It could be anything, but is there anything in particular that helps you stay motivated?
For me, it's going for a walk. We have a dog, and I'll take it for an hour walk every day. For me, just to get out into the woods and just hike with it, it just kind of brings me back and grounds me. I love that time, and it's just me and the dog, and we go and we hike, and when I come back, I seem more refreshed, and that's my big thing.
This may sound a little strange, but for me, having had to go back to work was also a way to save my sanity, because working with kids again and seeing improvements in them and their reading and things and I was like, I can say, wow, I had a part of that. Because sometimes the most frustrating thing for me is, how do I help Matt? How do I make that difference? What can I do? And so for me, it's just being back in the classroom sometimes and knowing that I am making a difference in somebody else's life too. And just having that opportunity to step back and look at things more clearly and not as negative, but as in a more positive way. And because
it brings you more positivity in your life.
Yeah, it does, because you don't want to be Debbie Downer, because that's
no.
That just isn't going to work.
Although I'm sure our friends want to listen. I'm always the one trying to prevent the Debbie Downer, and then I realize, well, gosh, that's part of what friends are there to shoulder. But anyway, so Mary, you in particular mentioned how, even doctors that didn't know that much about encephalitis, worked with you in the journey, and Rick, you to an extent as well. Do you have any tips? Several caregivers have asked what tips you have on getting doctors to get you more hands-on help. Sometimes they run into a roadblock, they're not getting answers, and they leave frustrated, either thinking, well, now I got to go find another doctor. But it sounds like you've had some good experiences in finding doctors that will actually study with you. So how did you do that?
Yeah. In the beginning, no. We went through probably 3 neurologists before we finally found one that was willing to listen. I always thought having the Cleveland Clinic in my backyard would be a positive, but that was really frustrating for me, not knowing that there were not a lot of doctors there that really had a good handle on encephalitis. But we found a neurologist who was really willing to work, and then she started asking questions to other doctors. Hey, I've got this patient who blah, blah, blah. That's how we got to our vision specialist. That is how we got to our therapy team. Again, that's how we got to a dermatologist, ear, nose, and throat doctor, all of those doctors that Matt has to see because of all of the issues that he has. And I'll never forget the first day we walked into the vision therapy office, that doctor came bouncing into the room. She goes, I have been waiting all week to meet you. I've never had an encephalitis patient before, and I want to learn all about it. And so it was like, wow. I mean, that just was so good. But you have to do your due diligence. You've got to ask the questions. And if they're not willing to find the answers or answer the questions or give you the information you want, then there's a whole bunch of other doctors out there that you can look at.
Yeah, and from our perspective, our situation, we were very fortunate. Our neurologist, he was excellent. He was probably one of the top neurologists in the province of British Columbia, where we are from. So he was well connected. He was aware of encephalitis, and he did point us in the right direction. And then with our GP, she wanted to learn as much as possible. So we had the best scenario that you could have. All I can say in what you're saying, Mary, is that if you're not getting, the correct answers or giving you anything, you need to, do your due diligence and find other doctors that will help you, because you need that. You
Yeah.
need to have that purpose for people, or you sitting there not understanding what's going on, and then you're just like bobbing in the sea, and that's not where you want to be.
And the other thing that I don't want to say demanded, but I really pushed for, and we have a program through Cleveland Clinic called My Chart, and they just recently have now opened it up. If some of your doctors are not in the Cleveland Clinic network, they can still reach into it. Has a different program name. So all MET's therapists and doctors now are talking back and forth. They can read each other's notes. They can see, which was a total disconnect before. If we had this doctor was from University Hospital, and this doctor was from Mercy Hospital, and this doctor was from the Cleveland Clinic, they weren't speaking the same language sometimes. And I was having to constantly repeat over and over to Dr. A what Dr. B said, and vice versa. So now it's like, oh yeah, it's in here, Mary, I can see it. Yeah, I could see that, she changed this medicine. Okay, I like that idea. So, that communication is the key. It really is.
They've only just started to bring that on in British Columbia or in Canada in the last 5 years, that there's a central data thing that all the doctors do their input, so anyone can bring up their files and see exactly where we are. As before, they didn't talk much. Every doctor you went to you started from square one, and you had to go through the same questions and give them the same answers, and they'd write it down and stuff. And now it's a lot slicker.
Yeah, and that's the key.
I think that's good progress.
It is good progress. And when you're having to start the story over from scratch every time, you lose so much ground. Yeah. So
yes.
So we have one other question. So this is a fun one to end on, and I can so relate. The person asks about if your loved one has any funny quirks, and I'm just going to tell myself real quick that what we do every day is we share the moment of the day, because there's always one. And one that I always do is I go to the light switch to refill my water glass instead of to the refrigerator, to the water dispenser. I don't know why, and I've done it so many times. But my family, we share the moment. But do y'all have any moments like that where you just get to laugh and it just kind of relieves some of the stress?
I've got a great one. We are definitely going to be writing a book, Becky. We're going to need your help, because we have what we call Mattisms. And Mattisms are Matt trying to explain what he wants us to understand, and he can't put the correct words together. The other day he was talking about the University of Oregon softball team, that most of the players left because they weren't happy with the coach. So he was trying to explain to us that the cream of the crop had left, and it came out whipped cream on a cornfield. Because and that's how he thinks sometimes. And we have got hundreds of these. So I now put them on Facebook, and my friends just get a real kick out of trying to figure out, okay, what was Matt trying to say? And you say to them, oh, you mean whipped cream on a cornfield? You're talking about cream of the crop? He goes, yeah, that too. But that's just something we just all laugh whenever he comes up with one of those.
That's great. I love it.
Wonderful thing to do. And he goes, why are you laughing at me? Matt, we're not laughing at you. We're laughing with you.
With.
Yeah, it's Wendy's thing is her short-term memory, forgetfulness. She'd say a story, and then minutes later she'd start retelling it again, and I'd give her that look, and then she would stop and say, I've told you this. And I said, yeah, about 5 minutes ago. Oh, and then we would laugh at it, and we keep it light like that because it happens more often than not.
Oh,
Maybe
absolutely.
2 or 3 or 4 times a day. But I think those are lighthearted things that it's become a unique thing with us, and even sometimes I do it. I mean, you know, as we age, we start doing that more often. But everything, I just give her that one look, and she sees that smile. I look at her, and she stops, and she looks at me and says, "I've just told you this story."
How fun. Yeah, it's important to laugh.
It is.
I want to thank both of you for your generous time and your raw honesty. I mean, this is so helpful for people that are in your role, especially the ones that are just at the beginning of the journey. And I know that I learned things from you and others will too. So thank you so much for your time. And we look forward to other questions and seeing how we can help in the future. So thank you so much.
Thank you, Becky. Thank you, Mary.
Becky, for putting this together.
You bet.
Yes, thanks again, Becky.
You bet. Take care.
Okay.
Bye-bye.
Oh, good. I'm leaving in 15 minutes.